Hi Cam followers, I hope you're well. Really excited this evening to have Diane Messum back with us. She is a veterinary physiotherapist at Davies Referral Centre, and she's done a couple of lives for us before, which have been absolutely brilliant. So if you didn't manage to catch them, I'm sure a lot of you have watched them, but if you haven't and you'd like to go back and watch them, you can have a look on the Canine Arthritis Management YouTube channel, and they are all there. But this evening, we are going to be talking about therapeutic exercise for the arthritic dog, and in particular talking about the underwater treadmill towards the end. So I'm just going to get Diane to introduce herself to those of you who maybe haven't seen her before, haven't listened to her before, and we'll go from there. Hi, Diane.
Hello, Nicki, and thank you for inviting me back. Hi, Cam followers. So my name's Di, and I work at a referral practice in Hertfordshire called Davies Veterinary Specialists. I've been there for 14 years now, where I solely specialise in small animals. My background is I'm a human chartered physiotherapist, so I qualified a long time ago, 18 years ago, and worked in human medicine for 12 years before specialising. So I work with a fantastic team at Davies. We work alongside the orthopaedic and neurology surgeons and the pain management team as well, which consists of the anaesthetists, physios and hydrotherapists. And so we see predominantly osteoarthritic cases in those clinics. So I hope that what I've got to share with you this evening will be of interest. I'm going to be extrapolating some information from the human medicine field. And then, as you said, Nicki, talking about underwater treadmill therapy and how we use that as well, and looking at the research and looking at how effective it can be. All right.
That's brilliant. Yeah, I think loads of people have that underwater treadmill hydrotherapy, and so they know a little bit about it, but probably not that much. So what we're going to do is Diane's got a presentation, so I'm going to get that up on the screen now, and we can just talk through that. If you do have any questions, then please do pop them down in the comments, and we'll come to them probably at the end of the presentation. And so yeah, please do ask away, share your experiences, and I'm just going to now share this presentation. Okay, so is that coming up on your screen, Di?
It is. I'm trying to control it. Yeah, I'm just going to turn. Okay, yeah. I think I have control. Let's try.
We can see it. That's brilliant.
Thank you.
There we go.
Are we on to the next slide, Nicki? Is it working?
We're on to, yes, we are now. Yeah.
Perfect. Okay, so I have quite a few slides which I'm going to power through, and if you have any questions, please, as we mentioned, pop them in the questions box and we'll cover those at the end. This evening, we wanted to give you an insight into exercise therapy and how we use it as a treatment for osteoarthritis and how it can improve pain and function in our patients. I think the first question that we all ask is, what is exercise therapy? And we refer to it as a regime or plan of physical activities designed and prescribed for specific therapeutic goals with a purpose to restore normal musculoskeletal function or to reduce pain caused by disease or injuries. Now, in our field, in veterinary physiotherapy, we take two approaches to using exercise therapy. So there's a lot of patients that we might see which we are treating for conditioning purposes or injury prevention. And that's a more proactive approach. So we might see those patients, particularly in their younger life, who might be more predisposed to osteoarthritis later in life. So we can look at how we can manage their bodies and keep them as healthy as possible early in life to try and prevent or minimize the osteoarthritic changes that could occur later in life. So it's that being proactive essentially. And then the other side of that is that we're quite reactive, and usually when we say that, it means that we're responding to an injury. So we come in and we're treating the patients after injury and rehabilitating them to try and get them back to as good as function as possible. And the same applies for osteoarthritis. So once osteoarthritis is diagnosed, we react to that and we look at how we can manage the condition going forwards. So if we looked at what we do in the human medicine field, we are essentially guided by these NICE guidelines, which are evidence-based recommendations. So what that means is that they look at the evidence and the treatments, different treatments available for osteoarthritis. And they say, well, okay, the 3 core treatments that we should be delivering to patients with osteoarthritis are A, making sure the patient's well informed. And in our case, we're referring to the pet owner or the caregiver. So we want to make sure that we inform you with as much information as possible, which is where CAM comes in. And I always recommend CAM to all of my pet owners. I will give me ask them to follow Facebook if they're on Facebook, follow the website if they're not otherwise. And you couldn't get more information than CAM are delivering to you guys now. So we give you as much information as possible. And I think it's really important you have a good understanding of your pet's condition so you know what you can do at home. It's empowering you, essentially. The second thing is making sure that exercise or in some form is undertaken. And we'll talk about the different types of exercise that will entail. And then the third thing, and a massive thing, which is actually, ironically, the cheapest thing you can do for your pet when they are diagnosed with osteoarthritis, is making sure that they are of an appropriate weight. So if you do need to lose weight, or your pet needs to lose weight, then it's making sure that you're following the right guidance with reference to that. So core treatments, 3 main things as we discussed. And then we do have additional treatment options as well, which have been covered in numerous live events. So I'm sure for those of you that follow these lives a lot, you'll have seen lots of information, and particularly last week on all the electrotherapy options. And you've had a few other physical therapists as well that have talked about physical therapies.
Yeah.
So types of exercise therapy that we have. And for those of you who have seen Louise Clark on the Facebook Live for CAM, this is Louise undertaking one of her crazy competitions outside of work. And this is Billy, her dog, who is an amazing athlete himself. So yes, aerobic exercise is a form of exercise that we'll be advising you, the pet owner, on, not to the extreme that we have Louise and her dog performing here, but certainly some form of aerobic activity. Then we talk about targeted strengthening, and what we mean by that is making sure that the muscles around the affected joints are as strong as possible. I love the reference, and I heard somebody talk about it a little while ago now, and they referred to the muscular system as being the biological scaffold for the osteoarthritic joint. So the stronger that muscular support is, the less direct forces that are going through those osteoarthritic joints there will be. And then also maintaining flexibility, so making sure that you maintain range of motion within those affected joints, because ultimately that's going to affect their function if they start to lose it significantly.
So I guess those 2 things are really important, are they, for the arthritic dog, the targeted strengthening and the flexibility?
Absolutely. And there's a lot of studies that have been done in human medicine that demonstrated that this is effective for pain and function, as well as quality of life as well, which we'll talk about. But absolutely, it's really important. So for those of you who haven't already or have a pet that's been diagnosed with osteoarthritis and haven't already consulted a physical therapist, even if it's just a waft, you will get so much information from that first session. They will have assessed your pet to the nth degree and looked at all aspects of the body and the effect of the osteoarthritic joint on the rest of the body, and they will give you recommendations and exercises to do with your pet at home. And if they suggest you might need to revise that a few months down the line or weeks, essentially, I think to get you in progress, it should be more regular. But if that's not practical for you to undertake, then it is possible to have a recheck 3 months later, and they can advise you on how things might change and what you can then do. So yeah, right. Absolutely. All right. So how can we use exercise to manage the clinical signs of pets with osteoarthritis? Well, exercise is great for managing weight as well. So not only the dietary side of things, but also looking at exercise to lose weight. And we also, there's a study which we'll talk about in a later slide that has looked at using underwater treadmill therapy to help with that weight loss as well. And it also will maintain muscle mass. So you want to maintain that muscular support around those joints. You want to use exercise to improve strength and maintain or improve range of motion if it's possible. and also it can help reduce the need for pain relief. So, but that should be done with the guidance of your veterinary surgeon and physical therapist, working as a team. And I know it's been discussed a lot previously, is making sure that everybody works as a team and you're all, you know, discussing the case with each other and making sure that you're doing the right thing for that pet and making appropriate sort of goals for your patient or pet. Yeah. Okay. Yeah. I think one thing I wanted to just touch upon is that when pets or people are diagnosed with having osteoarthritis, it's very easy to refer to the term as there's wear and tear on the joint. I'm a great believer in trying to avoid using that term, because wear and tear gives the indication that exercise can worsen the disease and modify the disease process. So I try and avoid that term where possible, because I think it's not, you know, it's not a very good term for the owner to hear, essentially.
Yeah, you're right. It's very commonly used, isn't it? And I've caught myself saying it before. I totally understand what you're saying, but we shouldn't necessarily say that. It almost slips out, doesn't it?
Absolutely.
Wear and tear, yeah.
It's very easy to say, and because it's a day-to-day term that we all use,
yeah.
we unfortunately all use it.
Yeah.
So there's also the emotional status of you, the pet owner, as well. And I think that comes into some of the research that's been done by Zoe Belshaw as well. It's looking at how you feel about your pet being diagnosed with osteoarthritis. I think it's a lifestyle change for all of you, and it's going to probably mean some drastic changes in what exercise was previously for you and your dog and your pet, and what it's going to be going forward. So you've got to try and manage that side of things. And it's also the owner's perception of the pain tolerance as well. So it's managing that side of things too, because I think an owner's perception of what pain their pet is in is very different to perhaps what we might see. And that's where questionnaires are very helpful as well, to make sure that you get a true impression and get the owner starting to question, actually, my dog is doing better and must be more comfortable because it's now achieving this, or perhaps it's less comfortable because it's now unable to achieve this. So they're very useful, those objective measures that you see with those questionnaires that are available. So some of you might work with physical therapists that do use questionnaires, those objective measures. All right. So I just wanted, this is quite a heavy topic and I'm not going to spend too much time on it, but I just took two of the main thought processes behind why we think exercise is so beneficial for pain management and pain relief. So we use the term exercise-induced hypoalgesia, and what hypoalgesia means is reduction in pain, so how exercise can reduce pain. One of the theories or thought processes is that it activates the endogenous opioid system, and it's one of the most studied pain relieving systems. The system essentially consists of widely scattered neurons in the brain, and that produces 3 opioids, including these endorphins that we might all refer to. So they are produced by the brain and they aid pain modulation. So that's the opioid theory. And then we have the non-opioid theory, which is the main one that we all refer to as the pain gate theory. And I've illustrated it here, or taken an illustration from Wall and Melzik, who came up with this theory. And essentially we've got the red route there, which shows the noxious stimulus, so the pain sensory nerves, and you've got 2 there, which is your A delta and C fibers, and they're very small nerve fibers which send messages to the brain. Now, because they're small nerve fibers, it can be pretty slow when you compare it to other nerve fibers. So what we can do is, through the larger nerve fibers, but also within the sensory nerve fibers which are on our body, we can override the messages to the brain by activating those larger peripheral nerve fibers through the green system there. And that's using destructive stimulus. And we might all relate to the fact that if, you know, when we were younger, we might have tripped over in the playground and the teacher would come up to us and say, oh, just rub destructive stimulus by rubbing sore spot, you immediately feel better. And so we can also use massaging, application of heat, and exercise in this case to try and override the pain messages to the brain. So for example, So you've got the pain messages that are going a little slower, but if you activate the large nerve fibers, then you'll get messages going much faster to the brain, and it'll basically close the gate to pain through the transmission cell. So it can be a bit complex. So if you're interested, please do delve deeper, but that's a small insight into the gate theory of pain.
So it's basically, I think the way I understand it is it's like distracting your brain from what's actually happening.
Absolutely. Yeah.
Yeah.
I couldn't have said it better myself. So there are 3 quite large studies. These are systematic reviews, and what systematic reviews are, they're studies that have collected all the available evidence on a topic and looked at it and essentially delivering what the best optimal treatment is, or what the findings are from those collection of studies which are all on the same topic. Now, the Cochrane database is an excellent database which again looks at the evidence out there, pulls all those studies together and then tells us what their findings are. We've also got systematic reviews, and we've also got meta-analysis as well. So these are the best types of research information that you can draw from, essentially, when you're looking at what the evidence is out there and how we can apply that to our patients. And what we've got here are studies that have looked at osteoarthritis of the knee and the effect of exercise on that. What we found is, particularly in that Cochrane review, is that there is a moderate effect on pain and function, and a smaller effect on quality of life, nevertheless a small effect on quality of life. And they've looked at that, they've taken that information from 44 studies that looked at exercise on function, 44 studies that looked at exercise on pain, and only 13 studies on quality of life. So not as many studies out there to look at that information. Okay. So yeah, this is high quality evidence we're drawing upon here. Then we've got another systematic review, and in this one they determined whether there is sufficient evidence to conclude that exercise interventions were more effective than a no exercise control. And what they did, they compared the effectiveness of different exercise interventions in relieving pain and improving function. And you can see here on the right hand side, for pain relief, they found that actually there was lots of different combinations and individual techniques that were effective for pain relief. So just strengthening alone offered pain relief, flexibility strengthening, flexibility strength aerobic, and then aquatic strengthening and aquatic strengthening flexibility. And then in function, what they drew upon was that they found that a combined intervention of aerobic strengthening and flexibility exercise was significantly more effective than the no exercise control. So a combination in that sense. And this study looked, they found this information from 60 trials. They did look at 12 exercise interventions. There was 8,218 patients that met the inclusion criteria in the study. So that was, they drew a lot. They've got a massive load of, a cohort of patients that they get this information from. And what was also interesting in this study is that they said that by 2002, there was sufficient evidence that had been accrued to show significant benefit of exercise interventions over no exercise control, which meant that further trials were unlikely to overturn it. So that was 18 years ago when I qualified as a physiotherapist. So really interesting. Now, what also is very interesting is this study found that exercise is as effective as drugs, but with fewer side effects. So if you look at the effect size on function and pain, you can see those purple and yellow lines in the pink box. Are pretty similar to those medications that those are taking. So you can get some pretty profound results, which is fascinating. I know that we obviously have to look at our patients individually, and we mustn't take this, take away from this, oh, well, I could take my pet off the drugs now because I know that exercise is going to benefit it and it'll help its pain. I'm not saying that at all, but it's just really interesting information how exercise can affect pain and function so well. And I think
as important by the looks of things from that chart, it's, you couldn't just if you want a really good outcome or the best outcome, it's not sort of a secondary thing that you would try if the drugs aren't working. You should, go full on and do, both those things at the same time, really.
Do both. And you're absolutely right, Nicki. And I think it's probably a really good point to raise here now, that when you're doing exercise, so I have a lot of pet owners that will come and see me, and within the first assessment, they'll say, oh, I really don't like my pet being on medication. I don't want him on long-term medication.
Yeah.
And I say to them, it's really important that you stay on the medication that's been recommended for you, certainly whilst you're starting rehabilitation, because if your pet isn't comfortable whilst they undertake the rehab, then they're not going to recruit those muscles effectively. You're not going to build up the strength and stability that those affected joints need. So you need the medication on board. It's really important.
Yeah.
Then maybe down the line, 6-8 weeks down the line, we can have a consult with your vet, talk to them about whether we feel the patient has improved in pain and function and comfort, and whether we can play around with the medication, reduce it first, see how the pet's coping. So really important that you follow the guidance on pain medication.
Yeah.
So aerobic exercise, I just wanted to really touch base on types of aerobic exercise, and we could probably take into day-to-day exercise, account day-to-day exercise when we talk about aerobic exercise, so taking your pet for their daily walks. What's really important as part of those daily walks is the type of activity that's been undertaken as part of that walk. So if you're going on your walks with a ball thrower, which I know that Cam are very against,
yes.
or think about what you can do to replace those activities. I know your pet probably has done it for years and years and are going to find it incredibly strange that suddenly you're not taking the balls checker with you on the walk. But you can do things to replace those sorts of activities, particularly in the home as well. Look at different brain games, hiding treats around the house and garden. Yeah. There's loads of food activities out there as well. So you can replace games that you have with your pet for different things. So low impact activities is what we do strongly encourage. We don't want to place additional forces through those joints to accelerate the progression of osteoarthritis. We want short and regular walks as well. So we want to make sure that there's no long periods of inactivity. You're encouraging movement regularly. And if you're not going for a third walk of the day, replace it with those brain games, hiding the food around the house and garden. Look at different activities you can do within the home. Avoid being one of those weekend warriors. Avoid having a good system during the week and going out for a 2-hour walk at the weekend and then thinking Monday morning, gosh, Buddy's really sore this morning. What's happened? So the likelihood is that there's been too many direct forces on those joints over that long period of time, and that osteoarthritic joint has gone, no way, I'm not having that. And definitely inflammatory flare up.
You just need to be consistent, don't you, really, with what you do? And because obviously you as the owner are the one that needs to control this. If it is as a person, if you had arthritis, you would know that it's hurting you and stop. But we all know that dogs, if you give them a chance, like you say, at the weekend to go for a 2-hour run, they will do it. They will want to do it, but then they will pay for it later. So it's our responsibility to control that, isn't it, really?
Yeah, absolutely brilliant. Yeah, no, I think it is our responsibility ultimately. And we've got to be the sensible person in all of this.
Try to be, yeah.
So avoiding jumping, leaping, quick turns and running. So the acceleration and deceleration forces as well through those joints. Making sure you warm up and cool down effectively, and monitoring for signs of exertion. I say to my pet owners, I ask them as part of my examination, I say, do you exercise your pet on or off the lead? And they say, oh, I do exercise off the lead. We exercise off the lead. And then my next question is, okay, if your pet's off the lead, are they walking and are they just interested in the sniffs and the sights around them? Or are they covering double the ground that you are on a walk? Are they running from one side of the field to the other? So it could vary from patient to patient. So what you advise each individual patient will differ depending on feedback from the owner.
Yeah.
And so if your pet is prone to racing around at 100 miles an hour when they're off the lead, then you're going to have to curtail that somewhat, or potentially likely to curtail that, and you will need to, you may be instructed to put them on the lead for longer periods of time than what you might have done previously. So it's really taking that into account too. Right. So the neuromuscular system. So another long word, I'm afraid. And this is a really nice definition. So neuromuscular control is defined as the subconscious integration of sensory information. So it's our body's automatic response, which is processed by the central nervous system, which results in controlled movement through coordinated muscle activity. Now, it's quite a long term, that, but basically it's our body's response to an unknown circumstance. Suddenly you've got a dog bolting out the blue, it's coming straight at your pet. He's got osteoarthritis at the elbows, and they come bounding into the shoulder and knock them off their feet. So if you've got good neuromuscular control, your pet is going to be better placed to cope with that sudden unknown circumstance and hopefully be able to maintain his posture and stability better as a result of having good neuromuscular control. So it's really important to optimize neuromuscular control in your pet's body, and that can be done through rehabilitation exercises. So it provides dynamic joint stability, assists in that postural control, and will improve movement patterns as well. And what can happen at the bottom of this slide here is that if you get injury or you have osteoarthritis, it could affect your neuromuscular system and result in impairments. However, if you also have impairments, it can increase the risk of injury. So you've got this vicious cycle here. So really important. If you've got a pet just recently diagnosed with osteoarthritis, I give my pet owners neuromuscular exercises, control exercises straight away to address that and try and maintain the current level with a view to try and improve upon it as well.
Yeah. So that's not necessarily about controlling pain, is it? It's just like you're saying, trying to make sure that there's the confidence in that muscular system that it can cope with stuff that's thrown at it.
Yeah, the unexpected circumstances. Yeah, absolutely. So for training for dynamic stability and neuromuscular control, the rehab program really has to include those targeted strengthening exercises we've briefly touched upon, balance and proprioception to improve neuromuscular control, aerobic activities, and then for the dogs that are still undertaking work or some form of sort of higher demanding activities, and specific exercises might come into this as well also.
Could you just touch on there where it says neuromuscular control for balance and proprioception, just for people that might not know what proprioception is? Could you just describe that for us, please?
So proprioception is the awareness of our joints in space, essentially. So it's the body's response to movement and speed within the joint. So the body can respond in a way that will protect that joint. So if we if a footballer ruptures a cruciate ligament in his knee, it can severely affect the proprioception, the awareness of where it is in space. So what you might find is that when you're testing proprioception in the human field, we might have had my patient sitting on the edge of the bed, and I would place his knee would be bent at 90 degrees, and I would place his foot in a certain position, and I would ask the patient to tell me where he feels it's positioned. And quite often than not, it would, or actually, tell you what, I'm describing it incorrectly here slightly. So I would place the good leg in the position I want him to then match with his affected leg. And quite often than not, it would be totally off, which means that the proprioceptive system has been compromised and has been affected. So he's not aware of where those joints are in space because there's been trauma or injury or the diagnosis of osteoarthritis, for example, in that joint. So I hope that covers that.
Yeah, thank you.
Then we go on to another study. We go back to the Cochrane review, but this Cochrane review looked at different types of exercise, and they found that there's no significant difference on pain and function between the type of exercise a patient undergoes in knee osteoarthritis. So you can see those bars are fairly similar across the board for quad strengthening, lower limb exercises, strengthening and aerobic, and a routine walking program. And then on the right-hand side, another study where there was 48 trials in this, and they compared aerobic strengthening and performance-based functional exercise, and they also revealed a similar effect on pain and function. What they did also find that there was significant benefit with a single type of exercise over a combination of exercise types in the same session on pain and function. So what that meant was try not to cram too many different types of exercises within one session, because they felt that this study, obviously this is a human-based study, but they found that if you couldn't do one type of exercise, you had to, if you were trying to do too many, you couldn't do one type very well. You were trying to split yourself across the 3 different types of exercises, for example, and you could never really give your osteoarthritic joint the benefit that it really needed. Does that make sense? I'm sorry.
Yeah, so to optimise the effect of it, you need to be doing one thing at a time. You need to still be doing all 3, all of the things, I suppose, but at different times and at different days. Or
absolutely, and that was one of the, you know, I'll cover that on my last slide. Is essentially you need to do all 3 things, but maybe on different days. So it's like, you know, going to the gym and then doing aquatic therapy, you know, underwater treadmill therapy on the same day. You know, you can't, you're not really going to get the benefit from doing the two types on the same day.
Yeah.
In water, and for many of us that are listening, you might have some hydrotherapy and immediately jump to the conclusion that that is swimming. It's not the case, as we will talk about. We also use water in a different way, and that's in an underwater treadmill or aquatic treadmill. There's a couple of terms that you may have heard. On the left, you'll see the dog swimming, and on the right, you see obviously the dog in the underwater treadmill. Now, the difference between those is that swimming is an open kinetic chain activity or exercise, which what that means is that the body part away from the trunk is free during movement. So the legs are free during their movement, and not any point are they in contact with a surface. So what that means is there's no proprioceptive endpoint. So to improve proprioception, you really ought to have your, you know, in a functional way, you need to have your foot in contact with the surface. And for example, balancing on one leg, or your physiotherapist has asked you to do a 3-legged stand with your pet, you know, by just drawing one leg away from the surface and getting them to maintain their core and dynamic stability and their balance through the remaining limbs as well. So open kinetic chain activities or exercise is, you don't have that proprioceptive endpoint, as I mentioned. It can be useful when there's loss of range of motion or swelling, which you otherwise wouldn't be able to, or your pet might find difficult when they're undertaking underwater treadmill therapy. So it can be a very useful form of exercise, but we're not going to be talking about swimming in depth today.
Whereas, I'm glad you said that, though, because as a vet, people often ask, because they know about hydro and the underwater treadmill, and they kind of just feel like it's the same thing. And they say, oh, this centre, they've only got the treadmill, so that's what we do there. But actually, it's really important that you are doing the right thing for what you're hoping to achieve in your dog.
Absolutely. And we only have the underwater treadmill at Davies.
Okay.
We did look at the opportunity to also have a pool, but the patients that we certainly see at Davies benefit more so from the underwater treadmill, in our opinion, and looking at sort of our research into it as well. So we get some excellent results with the underwater treadmill, and I may be slightly biased on that front, but there's certainly many patients I will recommend swimming for also. So it depends what the presentation is, what the underlying diagnosis is. The number of factors come into this. So we call underwater treadmill exercise closed kinetic chain exercise, which means that the body part away from the trunk is fixed during motion, and that can involve multiple joints. So what that means is that the foot strikes the ground and it's essentially fixed whilst the rest of the body is over it. So you have a more controlled delivery of exercise, because when a dog is swimming, there's less control. You can't manipulate where their limbs are going in space. If they're turning, you know, how is the limb or the swim stroke being performed? Particularly, for example, I'm just taking an example which if you've got a shoulder injury where they've got laxity of the ligament on the inside of the shoulder and you need to try and protect that ligament, if they're swimming and they're splaying, they're falling out, which is overstretching that inside structure, then that could potentially be detrimental, especially if you're implementing hydrotherapy at an early stage or too early in the rehabilitation process.
Yeah, that makes sense.
So it is better, you do have better control, which means also with the buoyancy of the water, there's less stress and forces, which can threaten healing structures too. It's more functional, particularly for many of our patients, you know, not only osteoarthritis, but certainly for the larger proportion of neurological cases that we also see. And it helps to restore any loss of joint proprioception too. So we use, these are the main properties of water. And temperature. Most centres will have to operate at temperatures in the underwater treadmill between 29 and 32 degrees. If it's a hot, sunny day, we might drop that a little bit, but certainly that's the recommendations, between 29 and 32 degrees. So there's a therapeutic warmth about it. So for those, certainly for the osteoarthritis cases, you want the temperature on the slightly higher side and to get greater benefit from it. So certainly towards the 32.
Right.
Then we have the surface tension. So, going back a step a second. So the temperature will increase blood flow. It can improve toxin elimination. So if you've got buildup of toxins or inflammation in the area, it'll flush out those mediators around an affected joint. And also it offers pain relief and will relax the dog as well, or you know, the temperature, the warmth will help you relax. We all know that jumping into a warm bath is very relaxing. So we're going to get a similar effect. Then we've got the surface tension and viscosity. So surface tension are the cohesive forces between the liquid molecules within the water. And that makes the surface harder to pass through. The viscosity, which is the fluid's resistance to flow. And again, that increases the resistance. So this is what improves our muscle strength. Viscosity and the hydrostatic pressure will also support the patient and improve the posture and stability. And also the hydrostatic pressure will improve any swelling that your pet might have as well. So if they've got swollen joints, it can improve that also. And then finally, the buoyancy is the upward forces that water can deliver to reduce the impact on degenerative joints and support those sore or weak patients. So there's different types of aquatic or water treadmills out there. There's the most popular one in the UK is the one on the bottom left of this slide here, which is a hydrophysio one. The Physiotech, I know that there's 1 or 2 centres in the UK that certainly use this. And then there's the other 2 are primarily American-based. They all have different designs, entry points, and some of them have jets and inclines as well. So everybody, you know, every centre feels that a different one is right for their needs.
So they don't all have inclines then? Some of them are just flat?
Yes, absolutely.
Okay.
It's usually an optional extra. So if you went to go and purchase one of these, they say, do you want the incline option, or do you want the jet option, for example? Okay. Some of them don't always have plates as well. So we purchased a treadmill that had side plates, which allows us to be inside the chamber with our patients. Yep. And that allows us to control, reassure them, makes less stressed and anxious because they know that someone's close to them and they can support them. And what's nice about the underwater treadmill as well is that the owner can also be close. I know we're in a COVID world at the moment and we can't be close with each other, but ordinarily we'll have the pet owner at the front of the chamber also reassuring their pets. So that's quite nice as well. Yeah, that's good. The treadmill in the middle is the Physiotech one, which I'm fairly certain is a German-based design, and it doesn't allow for a therapist to be inside that one. However, you can see the bars above, you can have a hoist attached to that, but also the floor raises up. So what's quite nice is if you've got a small dog, the floor will raise up and then you can work with the dog over the side of the water treadmill chamber. So that's another design which a lot of people find beneficial. Which one do you have at Davis? The one on the left, the far left. The hydrophysio, yes. And you also have options of different ramp lengths. You know, if you wanted a great, you know, if you've got space in your room, you can have longer ramps that have got a less incline, so it's not as steep for the patient to get into and out of the chamber as well. And they've also got a front and rear entrance, so you've got an entry point and an exit point, so you don't have to turn the dog around within the chamber as well. So just checking whether I'm covering everything. So I guess the main benefits are you've got the therapist inside the chamber reduces stress and anxiety. You've got the owner that could potentially be close to the patient out of a COVID world. You can increase the water depth gradually in any of these products. So you can, for patients that aren't happy in water, a lot of pet owners say, my dog hates water, it's going to absolutely hate this, I know it. I do often encourage them to try it at least once, and quite often they're very surprised at how their dog's taken to it, because what you've actually managed to do is introduce them slowly. I usually start them on a dry belt, so they really acclimatise to the moving belt first of all, and then we just literally put in 50 millimeters, so just a puddle, and allow them to walk in a puddle, and then we build at that water level really slowly until they feel confident. We do often have a lot of patients that as soon as you get up towards sort of mid forearm elbow height, their feet get stuck and they don't want to. And so really you being inside the treadmill is nice for them, because you can reassure them, because otherwise if their feet stuck and they travel towards the back door, suddenly you've got this pushed against the rear door. So that can happen, and that's why we like to be in the chamber, so we can reassure them, stop the treadmill as soon as we need to in those circumstances. But
do you fill it up depending on which joints you were trying to focus on? Would you fill it up at different levels depending on where you wanted it to work most, or would you ideally have the whole body submerged?
Yes, so the water levels do change according to the level and the stage of rehabilitation you're in.
Okay.
For the osteoarthritis patient, if they're quite sore, we'll probably fill it up quite high, but we don't want to work them too hard, because we all know if we're in a swimming pool, if we try and walk quickly through shallow water, it's fairly easy, but if we try and walk quickly through deep water, it's pretty hard.
Yes.
So you've got to really try and take that into account and set your speed accordingly as well. So you want a fairly slow speed to start off with if you've got your water level up quite high.
Right.
So if they become more comfortable and you feel you can drop the water level, then you can do so, and then you can perhaps pick up the speed a little bit to start building on strength a little bit more. However, you can build the speed up at a slightly higher depth. So I'm just a bit cautious at the exertion on the body when I do that. So I
guess it's quite good that most people will have experienced that, won't they, walking through water themselves. So you can really appreciate how hard this could be for some dogs to do this.
Absolutely. And if you haven't, I urge you to go and try.
Yeah, definitely. Yeah.
So and then you'll learn to understand what it's like for your patient and things.
Exactly. Yeah, they're doing a really good job. Yeah.
So what's nice as well about being inside the chamber is that we can facilitate movement, and you'll see a video shortly of one of my hydrotherapists facilitating movement within the treadmill of a patient. So we can really optimize the quality of the gait to try and achieve what our goals are, really, our end goals. It can also improve range of motion because the buoyancy of the water will lift the limb up a little bit higher. So we have a lot of pet owners that comment saying, "Oh, look, they look like a dressage horse," because their limbs are a little bit higher. So that's lovely to see, and very evident straight away. The first session, it's very obvious the improvements in range of motion that you can see. And then we've talked about proprioception, function, and can improve core stability and strength. It can reduce the stresses on those healing tissues as well, as I said, because you're, for example, early fractures or sort of at the right stage of any soft tissue repair, you've not got the entire body weight on those healing stresses. You're offloading it, but you've just got to take into account the speed at which the treadmill is set up to.
Right.
So you can use these for improving cardiovascular fitness as well. And like I said, it can be aided as a transition to land exercises. So if you've got those early, we're slightly going off topic slightly here, but if you've got a fracture repair, or you've got an early cruciate repair, for example, you might want to start them in the underwater treadmill before transitioning to harder exercises on land. So
yep.
Another practical thing is really, if your pet doesn't enjoy it the first time round, don't immediately write it off. Anecdotally, and no research has been done on dogs, they've only looked in horses, but anecdotally, as in a sound uninjured dog, it takes 2 sessions to really acclimatise to these underwater treadmills. So really give it 2 sessions at least before you make a decision whether your pet's going to benefit, and your physical therapist or hydrotherapist will talk you through that too.
How long are they normally in there for?
So the first session we literally do 30-second sets, 60 seconds if the dog's doing okay, but 30 seconds generally, and we might just do 6 or 7 in the first session, and then we'll increase it incrementally over the subsequent sessions. So you might go to your first session, you think, gosh, my dog didn't really do much walking at all. We do explain to the owner it's really important that we don't put them off in the first session. It's a good experience, and we are, it's additional exertion for them. You've got the resistance of the water that they're now walking through, and a lot of dogs will go home and they'll sleep for the rest of the day because it's not only physically challenging, or also emotionally challenging that first session particularly. So they are mentally exhausted when they get home. So this is a video which I took years ago, but it's a fairly clear picture of one of my patients a few years ago walking on the underwater treadmill. And for those of you that are used to analysing gait that may be listening in, his affected limb was the left hind limb, and you can see as the left hind limb strikes the ground, he brings the right hind limb, which is the limb nearest to us as we watch this, he brings it down quicker because he's trying to offload that left hind limb. So we call stance time, so it's the time that the foot is on the ground, is being reduced. And so we can use these treadmills to really analyse and get down to the nitty-gritty of what's really going on with our patient. On land, they might look normal, but when you put them in a slightly different environment, we start to pick up on those subtle problems, and it'll be the same with so same with our osteoarthritis patients. So that was haggis. And then
making that back foot up a bit higher as well.
Let's have a little look. So yes, you're right. So the swing phase, we describe that as the swing phase. So he is picking that left up higher. Now, whether it's the buoyancy, it was his left stifle. He had a complete stifle disruption, and stifle, for those that aren't familiar, is the knee. And so he had a disruption of the stifle, which he required this for. But he obviously he's restoring his range of motion very quickly in that one. So this is Remy, who is our hydrotherapist. And in this case, she is facilitating the hind limb gait. And I didn't ask Remy before I left this evening whether this was a neurological case, but I just wanted to show you different examples of what we can do within the underwater treadmill. But we can, if we've got a dog that's slightly shorter in its stride on one limb, and we're comfortable that their pain is well managed, then what we might do is we might facilitate a longer stride on that limb that's resulting in shorter stride to increase the stance time on the affected limb. So some dogs do compensate and cheat, result in that. So we just have to be a bit careful. So you can see she's got her knees on the plates in that treadmill as well. And Laura, who's our assistant as well, she's supporting the patient through the harness and also using treats to motivate him.
I was going to ask that because I couldn't quite see, but I assumed that was probably a treat that was, that he was lifting his head up for.
Absolutely. And we'll talk about the importance of the treat being placed at a certain height as well. So if you as a pet owner are taking your patient for hydrotherapy or in an underwater treadmill, you may be asked to help at some point. And how you help handle your pet will make a huge difference to the success of the treatment as well. Because if the treat is too high and the dog's looking up and extending its head and neck, you're going to get shorter stride length. So that can have an impact on your overall goal. If you've got the treat lower, you're going to get a longer stride length. So it can make a big difference. And some dogs lunge for a treat, so we might suggest that you place the treat outside of the chamber, so they look at it through the glass, so they can't lunge for it, which can make it in a regular gait. But there's so many different things that you can do to affect the quality of the session ultimately.
It's funny, isn't it? Because there are so many things to think about, but when you break it down, it all makes perfect sense. It's all common sense, isn't it? And if you think about it, I think this happens not just in this situation, but a lot of the stuff with exercises, like throwing the ball with the ball lobber. If you just take a few seconds to think about why that's not a good idea, it makes perfect sense. So everything you've just said is just, makes perfect sense.
So the other things that we can do, you're seeing Remy here applying therapeutic handling techniques, but not only that in the water, you can also use myofascial techniques, soft tissue mobilization techniques. You've got the heat, the thermal heat that you're getting from the water as well. And also you can do some joint mobilizations within the water, for example, active and passive range of motion to try and restore those movements that you might have lost or are losing, to try and maintain it, particularly in the osteoarthritis case. But so there's so many things you can do with an underwater treadmill. So I'll whiz through the next bit. Essentially I'm covering some of the evidence out there to say it's effective in in the areas we're hoping it's effective in, so it is beneficial for your pets. There's lots of research that's done. They've looked at physiological effects, so the effects on heart rate and respiratory rate, and they've looked at biomechanical effects as well. So the study on the left here looked at the effect of speed on heart rate within the underwater treadmill at the same height, water depth. And they noticed that when the patient went up in speed from a fast walk to a slow trot, that's when they noticed a difference in the heart rate in the study. There's another study here which was done before Daryl Millis, and he looked at the water depth on heart rate and respiratory rate, and what they noticed is that once the water gets to a certain depth, the heart rate tends to level off essentially. And so you've got certainly the one on the left, there's dogs exercising in aquatic treadmill at different water levels, and the blue line is the carpus, the orange line is the mid forearm, and then the grey line is the elbow, and you can see the mid forearm and elbow essentially are fairly similar in heart rate there. And similarly on the far right of the other graph too. I'm going to skip through because I'm conscious that time is cracking on to this study, because this is a study that looked at using exercise underwater treadmill therapy and client education in a weight management program for obese dogs. And what this found is that there was 8 dogs here of a various breed and gender. They went through a 3-month weight loss program, which consisted of lead exercise and underwater treadmill or aquatic treadmill therapy. Each patient in that study had 13 sessions approximately, and the water was at elbow height. There was a varying speed across the dogs depending on their size and other factors. And what they found is that 6 dogs who finally completed that ultimately had a mean weight loss of 18.9% over 3 months, which equated to 1.5% of weight loss per week. And
wow.
So interesting. I know that we're not taking aquatic therapy alone here. We're also incorporating land exercise and client education as well, which I assume, although I'm not sure the study discussed it in detail, but they were also talking, I'm sure they've probably spoken about dietary changes as well. But essentially, it certainly can aid in that weight management program. And also they found that the thoracic and abdominal girth decreased as well, which is that graph on the right hand side. Another study that's shown the difference in load on the joints as well. So ground reaction force is essentially the forces which are exerted by the ground on the body. So and buoyancy can obviously make a big difference to those ground reaction forces. So what they found is that once the water levels at the ankle height or tarsus, there's a 9% reduction. At the stifle, there's a 15% reduction. But if you get the water level right up to the hip joint, there's a massive 62% reduction. So if you've got a dog, yeah, it's huge. So if you've got a dog with osteoarthritic elbows or hips, and you wanted to get them as comfortable as possible, then you want to get those water levels
high.
Essentially. The study was conducted on in a treadmill where each limb was placed on a separate scale, and they raised the water levels, and that's how they took the data from this study. And then we've got the same study actually looked at how weight distribution between the forelimbs and high limbs change. So they noticed that the water level, as it rises, the weight increases on the forelimbs because the abdomen widens caudally. So what we mean by that is that the tummy widens as it gets towards the tail, and so the center of buoyancy shifts forward. I hope if that makes sense. So the implications of that means that the osteoarthritis patients might report less pain if they've got hip osteoarthritis, for example.
Yes.
Couple of other quick studies. Another study which is very popular looks at multiple physical therapies, including underwater treadmill therapy, and that was started at week 2 following cranial cruciate ligament surgery. So some of the pet owners that are listening might have had patients that have undergone TPLO surgery, TTA surgery, or any type of cruciate ligament surgery, and have gone through a regime or not, as the case may be. But certainly you can gain a lot of benefit from including underwater treadmill therapy as part of that rehabilitation program. So this study had 8 dogs. They had physio 3 times a week. They had water level in the water at greater trochanter depth, which means at hip level, and they were at a comfortable walking speed. And what they found is underwent physiotherapy, and so you can see the difference on the left hand side. The graph heights are larger, which says the thigh circumference were bigger, as opposed to the home exercise program alone, which was just purely lead exercise. And then the affected limb, so the affected limb, you can see the round circles on the middle chart slowly grow. So the thigh circumference increased over those 6 weeks, where the thigh circumference stayed the same on the affected limb throughout those 6 weeks. So you didn't increase in muscle mass. And 6 weeks after, you see that the physiotherapy has equaled out between the 2 limbs, whereas the home exercise program, you can still see a deficit. So the white bar is the operated limb, and the grey bar is the unoperated limb. And I suppose the other benefit that we should say here is that for anyone whose pet has undergone stifle surgery following cruciate tear, is that not only are you undergoing rehab for the operated limb, but you're also rehabbing the contralateral limb, the opposite limb, which could also be vulnerable to a tear later, unfortunately, for a large proportion of those dogs. And then there's another slide that just talks about the range of motion. And again, essentially what this means is that the range of motion improved drastically in the physiotherapy group compared to the opposite limb and those that didn't undergo physiotherapy. So physiotherapy can also improve pet owners' compliance because we can guide you through what you should do, and as we said, minimises rupture of the contralateral limb. And also what this study also said was it minimises the onset of osteoarthritis, which is what we're talking about today, by maintaining motion strength and that neuromuscular control as well. And they also found that adding omega-3 fatty acids and a protein diet would improve. They found that increased forces and comfortable forces through the affected joints as well. So the limb was being loaded greater, presumably because it's more comfortable, and to reduce the progression of osteoarthritis in the first 6 months following surgery. Temporospatial changes, so different changes within stride length as water depth increases. So as water depth increases, you get increased drag, so resistance, you get increased buoyancy, stride frequency will reduce, so it's a bit slower, so there's a delay in reaction time. Stride length increases, the stance time reduced, so the limb isn't on the floor for as long, so again has the implication for our osteoarthritis patients if we're trying to minimize the forces through those joints.
Yeah.
And then the swing time increases, and then there's also changes that can occur within but I'm going to not spend any time on that slide because I want to move towards the end. So last, but I think we're coming towards the end. So this study looked at different range of motion, and essentially in a nutshell, they took some dogs, they had 3 walk trials at 4 different water depths, and they found that hip flexion, extension, range of motion was greater as the water height increases. So as the water gets up towards the hip, you get better range of motion in the hip. As the water height increases towards the hip, you get better range of motion from the stifle. And this, if you're trying to improve range of motion in the tarsus, if you've got a tarsal osteoarthritis patient you're treating, then the range of motion is greater in the water at the tarsus height, essentially. So that's quite useful information when we are planning our patients within, for their rehab.
Yes. I mean, I guess the problem with a lot of arthritic dogs is that they have arthritis in many different joints, don't they? So
yeah,
you probably go for the highest volume, I would imagine, to cover as much as you can. Yeah,
absolutely. Yeah, but then we come on to this study just to throw it in there, Nicki. And we need more of these studies, and I would love to be involved, or certainly hopefully there will be more being undertaken, but it just takes time. And this is a study that came from Hartbury College, and they took 7 different dogs. They looked at them in one session, and they were exercising for 2 minutes at each water depth. So there's 1, 2, 3, 4 water depths you can see on that image. And they put EMG, they examined the electromyographic data from gluteus medius and latissimus dorsi, so looking at the activation of the bottom muscle, gluteus medius, and latissimus dorsi, which is a muscle that runs alongside the spine. And what they found is that as the water level increased, there was a reduced workload for the bottom muscle and the spinal muscle between sort of the hock and the mid, and stuff in the hip as well. So as the water level went up, the muscle activity reduced in those muscles. And I guess that's what we thought might happen, because if you've got a treadmill moving underneath your dog, it's retrapped in the limb itself, so the dog doesn't need to activate. And recognizing this, if we want to strengthen that bottom muscle for hip osteoarthritis, we need to recognize that if we got the water level up, we're not likely engaging that muscle in the way we would like. So so what we do at Davies is that we say, okay, we're not activating it during normal walking, we're activating other structures. So it's really important we still do walking, but we also add in more advanced techniques. And that's where we might use resistance bands, or we might do some backwards walking with them within the water. So if you might see us doing some very unusual techniques, but the goal is to try and activate those muscles in different ways using our underwater treadmill tool. So this is the treats. We've talked about this. So different treat height and its effect on gait. So the lower the treat, the longer the stride, the higher the treat, the shorter the stride. And then finally, exercise prescription. In a nutshell, it's really important you get the correct type dose, and the time is important, and progression is gradual for each of one of our osteoarthritis patients. Recommendations that really come out from the human field is that it's really important to combine strengthening aerobic and flexibility exercises, and that can be on land or within a water environment. Perform different types of exercise on different days. Physio-supervised exercise is recommended in the human field, and obviously we need to make sure it's practical for our patients. They recommend exercise 3 times a week, and 12 one-to-one sessions in the human medicine is recommended. However, again, it's looking at practicalities of being able to deliver that within our environment as well. So we make sure that we try and set the pet owners up for as much success to be able to do a lot of it at home themselves. So making sure the pet owner is aware of the benefits of the actual exercises, incorporating function exercises that can be done as part of your normal daily walk. So I think that's really important, because we can do those targeted strengthening exercises on a normal walk, so it doesn't feel like it's, you know, too much hard work to do. And
you don't need to fit it in as an extra thing that you need to do every day. It's just, it can become part of your routine.
It's really hard otherwise. And then making sure, if you are using equipment, making sure that it's, you know, our owners have got this available for any additional exercises we might add in as well. So yes, so I will stop talking now and take questions. I hope that was useful and helpful information.
It was really useful. I think it's just really important to reiterate that, you know, it's all three things. So if you go to the physio and you're just coming home with strengthening exercises, that might be because that's the most important thing for your dog. But we should be looking at all three of those areas to try and cover every week that you're doing something aerobic, strengthening and flexibility with your dog.
Oh, you've frozen, Nicki.
Oh, there you go. You're back now. Can you hear me?
Oh, I can. Sorry.
Yeah.
Did you ask me a question?
No. So yeah, for me, that's just the take-home message for me is that we need to be looking at more than just one thing with physio, and that it has to be probably is going to be different in each of those categories for each dog, but we need to get a good plan, and which is why it's really important that arthritic dogs do come for physio and use that in conjunction with the drugs, with your acupuncture, with weight management as well, which is obviously so important. So we're just going to go through a few of these questions, if that's okay. There was one right at the beginning that I just wanted to go back to. So we've got a question here from Lindsay Ross, and she is asking here, just wondering, and I think we've probably covered this now, but just wondering if it is safe for a dog, 9.5-year-old Whippet, to have hydrotherapy on the treadmill if she has flexor tendon issues on her back left paw. The toes sit at a slightly strange angle. She has had hydrotherapy before, but as she had a couple of ops for disc issues on her back, would it be safe to do so with her tendon issues and slight arthritic pain?
Ooh, I probably want to know a bit more about the tendon issues and what the problems are regarding that. I think if it's a routine, if it's a tendinopathy, which is any, you know, changes within the tendon itself, it should be. I would certainly see a physiotherapist first for an assessment and get their recommendation based on their assessment before undertaking that. I think with your Whippets, I think they will be better placed in an underwater treadmill, just because we probably know that Whippets aren't natural swimmers, or I might be, unless there are some special Whippets out there. But I think the water displacement of the body relative to the limb length is doesn't make them to be natural swimmers. So I think the underwater treadmill would be a safer form of hydrotherapy to perform.
More controlled.
Yes, and so I would, I'd like a little bit more information, Lindsay, if you can help, or certainly if certainly seek physical therapist advice first of all before embarking upon any hydro.
So almost certainly there'll be things to do on land first before you went to do the treadmill, I would imagine.
There may be, but they may also suggest starting in the underwater treadmill, which is the transition to harder exercise, you know, to exercises on land. I'm seeing a couple of patients at the moment that have what we call common calcaneal tendinopathy, so like an transition. You there?
Yeah, it just cut out a little bit. It just cut out as you were saying Achilles, but basically Achilles injuries. Yeah.
So I'm seeing them for Achilles and using the underwater treadmill as a transition from to more advanced land-based exercises, because I can offload the tendon a little bit more in a buoyant environment and load it that way, and then reduce the water level, gradually increasing the load on the tendon. Because when you rehab tendons, you need to increase its tolerance to load slowly and practically.
Yeah.
I'm seeing those sorts of cases. So yeah.
So yeah, definitely worth seeing your physical therapist or asking your vet and getting a referral to a physio to look into that. One here about in Spain. I found a great centre in Spain when my lab turned 17. Wow, that's amazing. And thanks to the underwater treadmill, she lost 9 kilos and gained muscle structure. So that's going back to what you were saying, Di, that, you know, in that study about the weight loss, it can really help as part of a weight management plan as well. So definitely there's proof in the pudding there. Also had laser therapy twice a week. We know maintenance function and highly recommendable. Basically, that comes down to that. Tish has written, would age, i.e. nearly 14 years old, preclude my dog from benefiting from hydrotherapy on a treadmill? So absolutely not.
No, it's lovely. We've got a few golden oldies, as you call them now, and they can't do much on land because they are quite sore. They're end stage elbow osteoarthritis cases, and yet walking in the water looks much easier and more comfortable for them. So it's lovely as a form of exercise. And you know, if they can't go very far outside of the house, it's a trip to a different environment. You know, it's mental stimulation for them as well as a form of exercise therapy. So no, not excluded at all.
No, they probably feel amazing after they've been in the water, even just to have that temperature around them for that, you know, that feeling, like you said, you know, the temperature can help with that pain as well. Kenzie, Libby loves her underwater treadmill. Our vet has a new one that does incline, jets, and the treadmill can reverse. Wow. So the dog can turn around and jets are behind her. Yeah, all singing, all dancing. That sounds good. So a lot of people are commenting that they have used it. We've got one here about flotation device. My dog is ball driven and I've had to hide all the balls. We do swim in the nicer weather, which is limited obviously in the UK. So she has a chance to retrieve while swimming. She is a strong swimmer and I wondered if there is an opinion on a flotation device while swimming. Is that anything that you could comment on?
Let me just read that question. Sorry, you moved it quickly.
Sorry.
So that's all right. If she's a strong swimmer, I'd say it is safe to continue without a flotation device. Flotation devices are used certainly in the beginning to improve confidence and support some weaker dogs. But if you've got a dog who's strong and comfortable swimming without a flotation device, I would say it is perfectly reasonable to continue in the way that you are doing, is what I'd say. But if they're getting a bit older and they need a bit more support, then it may be practical to revisit that.
Yeah, or even try the underwater treadmill if you're using it specifically for something where you need a bit more support and that contact rather than that free swimming that you get with hydrotherapy or normal swimming. Human studies. Oh, I just missed that one. So Laura's written a couple of things here. Human studies tend to be in older adults with primary osteoarthritis. Does this make a difference when interpreting the results in the canine world, thinking dogs with osteoarthritis can be quite young and tend to have secondary osteoarthritis?
I think when you look at the mechanism behind exercise-induced hypoalgesia and the theories that we believe to be true when you're looking at using exercise for management of pain and function, I think you can apply some of it, but I hear what you're saying, Laura. I think we obviously are dealing with slightly different conditions here, I suppose, primary and secondary conditions. So yeah. I think it's certainly sensible to consider that, but I think my feeling is that any form of exercise will give a hypoalgesic effect if it's delivered correctly and for the patient that you have in front of you, essentially. So because every patient is very different, so what suits one patient will be very different from another. So I think you have to take it individually. Yeah.
And just a couple more down here. Going through them because lots of people commenting that they do this and it's really useful. We've got one here from Jenny. How many times per week should you do exercises at home? So I think you kind of touched on this at the end with the general recommendations of 3 times a week. And are we saying that's going to be the same in dogs?
So that's the human medicine feedback and general advice. I would say in dogs, when I'm starting them off on a rehab program, because they can only do a small number of exercises, and it has to be of good quality as well. So you need to make sure that you're giving a repetition for each exercise, ensure that the dog's not fatiguing and going to cause further harm to itself. So when I'm doing that, I might suggest low repetitions, maybe 3 times a day initially, until they've built up to an appropriate level, at which case then I say, okay, you can reduce the number of times a day you're doing it to once a day, or for some cases that are doing quite high loading activities and much more challenging strengthening activities, then you could consider 3 times a week. I mean, I think that comment probably comes more from the human field when you go to the gym, 3 times a week to try and maintain your strength and stability. So I would say 3 times a week is reasonable on a maintenance level, but to get to that point, it needs to be more regular. Okay.
This has been incredibly useful. I have a million questions, but I will be speaking to a physio soon about what's best for my girl. Yes, and also, I mean, there will be other questions that come up. And like I said at the beginning, I would urge you to go onto the YouTube channel and watch the other Facebook Lives that Di's done, because they may answer some of the questions that you have there as well. They're really useful. Given arthritis is often diagnosed relatively late, do you think there's benefit for regular physio reviews in a non-osteoarthritic dog to enable earlier identification and therefore management of any problems? Would this possibly improve long-term outcomes if the dog did go on to develop osteoarthritis? That's a really good question.
That's a resounding yes in my book. As physios, and I think Laura, I think Laura's a physio background as well, human physio. So I think we are trained to understand feel of joints and changes within them, so we can feel what we call different end feels. I see patients, you know, from very young to the very old, and I might see, for example, a 2-year-old Black Labrador for a completely different problem. But on examination, because I'm very thorough and I assess the dog from head to tail to look at any other issues that arise and that we need to factor into our rehab plan, I might identify early signs of changes within, for example, the metacarpal phalangeal joints that go completely unnoticed, or the carpus might just not feel like it's going to its full range or its full potential. Yeah. So we can identify that early, and quite often when I feel those changes, I say to the owner, has your dog ever had any forelimb lameness, or has your vet ever identified any problems in their limb when they've examined them? Quite often it's a no. And I'm saying, I'm not diagnosing anything here, but I'm suggesting there are clinical signs that are changes occurring within these joints, and I think we need to be proactive in managing this now. And I think that will be really key, because at that point, straight away, you're educating the owner on the long-term management and hopefully preventing in life as well. So Laura, a really good question. Thank you for asking that.
That's a good question. I think it also falls on vets to kind of look into this as well. So we normally will only see dogs sometimes only once a year, and we will pick up some changes, you know, like you'll do a little bit of a mobility check and feel there's a bit of stiffness, maybe a little bit of muscle atrophy. And it would be lovely if we could send all of those dogs straight to a physio who are amazing at doing those things. And like you say, pick up the even smaller changes that we don't pick up. And then, I mean, it might not be that you do very much, but you could already change things like stop throwing the tennis ball or stop the twisting and the jumping and that kind of thing. That then, yes, definitely could prevent it getting worse, couldn't it? So,
absolutely, yeah.
A physio check would be great, even if there's nothing wrong with your dog. Sorry if I missed this, but with the height of treat effect on stride length, what's the trade-off on weight bearing? I.e., with a lower treat, would you be encouraging increased weight bearing on the forelimbs when that may not necessarily be desirable?
I think depending on the water height, I think if the water height is at a level which is reducing the load on those affected joints, I don't think you're going to get a great amount of difference. There isn't research out there to back up that theory, though. That's just anecdotally from what I can see. So I don't find that it changes the way that they move and their head carriage. You know, with lameness, we see a head nod. So as the affected limb strikes the ground, the head will elevate. And I don't see that usually, you know, for the severely arthritic dogs in the underwater treadmill. It's lovely because when I assess the gait on the land, you see that really obvious head elevation as the affected limb strikes the ground. But in the water, that's so minimal. It's lovely to see once you've got the water level up to the height that you need for that patient. So I don't feel it makes a huge difference myself, but certainly perhaps it's something to look into from a perspective.
Yeah, that's another good question. For an almost, this is from Jenny, for an almost 2-year-old lab with moderate hip dysplasia in one hip, at the moment he gets physio, laser and hydrotherapy every 3 weeks. Yeah, I mean, that sounds right, doesn't it? It sounds like a good idea.
So I think, just one comment, I think every patient is different and individual. When we're setting up a hydrotherapy plan for some of our patients, we start off at least once weekly, because I think any less than that and you're not going to build up the strength and stability in a quick enough fashion that you need to do so. And with that, they've also got land-based exercises, so they both complement each other to get to that desired endpoint. 3-week intervals are the absolute
sorry
to be on that, because I think it's like me.
It just cut there.
Sorry.
Did you say 3-week intervals would be the absolute maximum between?
Yes, so absolute maximum, because it's like me going to the gym once every 3 weeks. I'm not really going to get any benefit from that. So I say that's the maximum before on a maintenance regime. So I don't like using the term maintenance regime, but I think it's enough once you've got to an established level then to try and maintain it. But it's not only the maintenance in the underwater treadmill, it's also having the contact with your therapist as well to make sure that they're happy with the progress that your dog's making. So some owners like to stay on a 3-weekly visit because it checks in with your therapist and they can identify any changes or any other things they need to address as part of that session. So
yeah, that makes sense. What there? That's one there. Sorry. This is from Kenzie. I used to take my current dog to my older dog's rehab sessions, and it was the rehab specialist that picked up on her hip issues at a relatively young age. So that just goes back to Laura's question about, you know, if you're checking regularly, you might pick up on these things. Rachel, I'm looking at doing a research project using a pressure walkway to see if early osteoarthritis detection can be made earlier at senior dog checkups. Great. Let us know how that goes. And Laura said, yes, she is a human physio. Yes, this is, again, this says, kind of confirms why checking these things earlier is better. We have taken our Newfoundlands for monthly canine, chiropractic, canine massage and hydrotherapy for years. One of the Newfies was diagnosed with osteoarthritis earlier this year. The vet said it was probably those regular treatments that kept him from presenting with symptoms much earlier than he did. So yeah, there's no harm in getting these things checked out, even if they're not showing symptoms. And what I'm going to do, because we are running, we've taken up a lot of your time tonight, Di. Sorry. What I'll do is go through these other questions, and if we have any others that we haven't answered, I will get some answers for you and jot them down on the Facebook page. So thank you very much, everyone, for joining us tonight, and thank you so much, Di. Really, really useful information for everybody. And yeah, if you do have any more questions, please pop them down, because I will be checking and I can answer them in due course. So enjoy the rest of your evening, everybody, and we'll see you soon.
Thank you.
Bye.